Thank you for joining us for this Adult Education Senior University session, Solving the Medicare Puzzle with SHIP. Our presenter today is Megan Rogers. Megan has worked for over 18 years in the social services field in Michiana, and she graduated from Bethel College with a double major in sociology and criminal justice. She has 4 years of experience working at the local community mental health center and 10 years working with the Area 2 Agency on Aging, Real Services, Inc., with the aged and disabled populations. Currently, she is the Northwest Indiana Region Volunteer Supervisor for the State Health Insurance Program, SHIP. Megan has vast knowledge of aged and disabled, TBI and BDDS waivers, nursing home assessments and approvals, and person-centered planning techniques, where each position required her to have an extensive knowledge of Medicare and Medicaid. Megan is a certified memory care professional, is certified in the suicide prevention techniques of QPR, question, persuade, and referral, and assist, applied suicide intervention skills training. And she holds a certificate in nonprofit business management from IU South Bend. She is also the primary caregiver to her father, and she resides in Plymouth with her husband. Thank you so much, Megan, for making your journey out to IU Northwest and to be here with us today.
Thank you, Amanda. I'm excited to be here. All right, so one of the big focuses for today is talking about what SHIP is and how we can help you and who our SHIP counselors are. But we will be touching on Medicare. So we'll be talking about the different parts of Medicare, Part A, Part B, Part C, Part D, and supplements. We're going to talk a little bit about how you get enrolled, a little bit about some enrollment periods, and then there should be time for questions at the end for those on Zoom and for those in the room for things that I didn't touch on, because we've got a lot to cover in 60 minutes. And when we do talk about drug coverage, I'm going to spend most of that time talking about some of the amazing changes that are coming to Medicare drug coverage for Medicare beneficiaries in 2025. So let's get started here. So the state health insurance program is free and impartial Medicare counseling. We are not insurance agents. We don't have insurance licenses. We're not contracted with specific insurance companies. We're primarily volunteers, either volunteers that work for certain agencies or for retirees that want to learn about Medicare and give back to their community and help people understand what they need to do. We are grant funded through the Administration on Community Living, and we're housed in the Indiana Department of Insurance down in Indy. So our mission is to empower, educate, and assist Medicare-eligible individuals, their families, and caregivers through objective outreach, counseling, and training to help them make informed health insurance decisions that optimize access to care and benefits. The SHIP vision is to be the known and trusted community resource for Medicare information. We are able to help you with anything that you need help with when it comes to Medicare. So you're new to Medicare, we can help you understand the different options, because that's one of the reasons why Medicare is confusing, because they provide everyone options. But then you have to unpack all those options and figure out what is the best for you, because everyone here in the room, at the library, or on Zoom has different needs, preferences, wants, desires with their health insurance. So Medicare is great because it has so many options, but that also makes it confusing. And there's a lot of false information out there about Medicare. So it's very important that you're listening to the right people to give you the right information. Your family members, your neighbors, your friends, they probably maybe don't know all the accurate information. If they're getting something that's false, they're passing on that false information to you. So you want to make sure that you're getting that information from a trusted source. So we can help you when you're new to Medicare, when you're old to Medicare, during enrollment phases, if you're having issues with your insurance and you're getting denials, if you need to appeal something, we can help with that. So a little bit more on our role. We can provide you with educational materials and brochures. We can help you understand Medicare and organize your records. Sometimes I set up appointments with people to go through all their mail, because you're going to get a lot of Medicare mail, and most of it is junk / scams / marketing material that you don't even need to have. So we can help you figure out what is important to respond to, what you need to keep, and what you can throw away. And usually by the time we're done, the pile of what we throw away is a lot bigger than what we keep. And we can help you figure that all out. We can educate you on how Medicare claims are filed and how you can appeal Medicare decisions. We can teach you to assess your needs so you can make informed decisions about your health insurance policies. So some of the things we talk to primarily new to Medicare people when they're trying to decide if an Advantage plan versus a supplement is better for them is, what is your current health history? What do you take medicine for? What kind of surgeries or hospital stays have you had in the past few years? What about family history? What does mom and dad and siblings have that you may develop later on? Because making informed decision is very important when you're new to Medicare, because you may not be able to make changes to that decision later on. And 65 is still very young, and you're going to have to pick insurance that is going to work for you for 20, 30 years. So we can help with that. Informs you of your rights as someone with Medicare or health insurance policy holder. We show you how to evaluate the various prescriptions, Medicare supplements, which are also called Medigaps, and long-term care insurances that are currently available. We refer you to appropriate agencies that can help you with other needs. So sometimes when our clients come to talk to us, other things come up. You know, we're hearing that you need maybe in-home care services, or you need to go to an assisted living or a nursing home. We're not necessarily going to be the ones to give you that hands-on assistance, but we know the agencies out there that can. So we give referrals to other agencies all the time. And then we can provide speakers to make a presentation to a group, club, or senior center. So just like I'm here, I'm talking to you about Medicare, I can come out either in person or virtually to church groups or senior groups, senior centers to make presentations. So if you're part of a group and you think that learning about Medicare might be helpful for your group, let me know. And I'm happy to get that scheduled either with myself or one of my other SHIP counselors. So we recruit and train both volunteer and in-kind counselors to program services. So our SHIP counselors are highly trained and certified. Some of them are Medicare beneficiaries themselves. Some of them are family members of Medicare beneficiaries or caregivers. So we help you inform you about Medicare Advantage plans, Medicare prescription plans, that's the Part D standalone plans, and Medigaps, which are also called supplements, on how they work, what they cover, what they don't cover, if there's networks to be mindful of, if there's restrictions or denials. We help explain how supplemental insurance options work with Medicare. So if you have like an employer plan or a retiree plan, VA benefits, Medicaid, those all work or don't work with Medicare in different ways. So we do have a healthy knowledge of those other insurances and can help educate you on that. We do provide information again on long-term care services or insurance. And again, we refer beneficiaries to other agencies, so Medicaid, Social Security, or even the area agencies on aging. Over here in Lake County, that's CoAction, used to be called Northwest Community Action. And they just recently changed their name. And I do have SHIP counselors at CoAction as well. So who are our volunteers? Who are some of the people you'd be meeting with? So we have retired business people. I've got some counselors that are retired from working at the Social Security Administration, teachers, doctors, nurses, Medicare beneficiaries, lawyers, nursing home administrators. So I have a whole wide range of different retirees with different backgrounds. And then we do have some staff that are currently working at different agencies that become SHIP counselors. So I've got social workers, I've got healthcare navigators at 219 Health Network, HealthLink, and North Shore, which some of you, those names may sound familiar to you because they're health clinics over here in Lake County. So they're healthcare navigators that work with Medicaid and Marketplace, are trained also in Medicare. Area Agency on Aging staff, so that's the co-action staff, active nurses, and medical billing staff are also some of our counselors. So how can you become a counselor? Or maybe you know someone that might be interested in this. You can submit an application to become a SHIP volunteer. That's on our Indiana.gov SHIP web page. And if you do have someone that is interested, or you may be interested, you can contact me, or for those on Zoom, you can put a request in the chat box or get with Amanda to share my information. I think at the end of the slides, I do have my phone number and email as well. Consent to a background check. Very easy background check. It's basically just certifying that you don't have a current insurance license, because again, since we have to be impartial, we can't have any active insurance agents become a SHIP counselor. This says 4-day training. We're actually down to 3 days. Usually it's about from 10 a.m. to about 3 p.m. And we learn everything about Medicare. We're gonna go into the nitty-gritty with Part A, Part B, how you enroll, supplements, Medigaps, Advantage plans, drug coverage, Medicaid, all that fun stuff. After the 3 days of training, we do mentoring, because we're not just going to throw you to the wolves, because Medicare is a very in-depth topic, and we're going to do mentoring where you're going to watch me or one of my seasoned counselors do appointments. And then after a certain amount of appointments, we're going to switch where you're going to lead, and then the seasoned counselor or myself will sit back and observe, and we'll step in if we need to. Otherwise, we're going to try to keep our mouths shut. And then afterwards, once you're feeling comfortable, you're going to go solo. But if you ever have a situation, you're like, I don't know what to do with this person, you can call me to help you work out the kinks of that situation. I've been a SHIP counselor for 11 years now, and I still run into new Medicare situations. And I'm like, how do we do this? So it's a lot of problem solving. It's a lot of working together as a team to make sure we're meeting the needs of our Medicare beneficiaries and they have the health insurance that they need. And then we do have 2 annual trainings each year. There's a fall training, a spring training, and they're about 3 hours long. So where can you find us? So in the state, we have about 130 SHIP partners. So again, places like North Shore or the area agencies on aging, hospitals throughout the state. We even have a couple thrift stores and libraries in Southern Indiana that provide SHIP counseling. We have 400 volunteers statewide. In the 11 counties I cover, I have about 100 volunteers myself. We have our call center number up here on the slide, so feel free to jot that down too. 1-800-452-4800. So you can call them if you can't get a hold of me, and you can just say, I live in East Chicago, or I live in Crown Point. Where's the nearest location for me to go? We also do appointments virtually. So we log into Zoom like some of us are on today, and we do the appointment virtually. We can also do them over the phone, and we do them in person as well. All right, so we are going to dive in more now onto Medicare. Enough with talking about SHIP. Again, if you have questions about SHIP at the end, we'll cover those, but let's talk about Medicare. So Medicare is for 3 groups of individuals. The most common one is 65 and older, senior insurance. But then we have under 65 with disabilities. So any age, you're getting Social Security disability income for 2 years. And then after 2 years, you're automatically enrolled in Medicare. So we actually do have quite a few younger individuals, 30-year-olds, 40-year-olds. We even have children on Medicare. And then any age with end-stage renal disease. So if you have an end-stage renal disease diagnosis, after having that diagnosis for 4 months, you can get Medicare. Now that one's a little bit unique because if you have a transplant after a certain amount of time after the transplant, your Medicare will end, and then you can get your Medicare back once you qualify due to disability for 2 years or being 65 or older. All right, so this is a very important slide, so we're going to spend several minutes on this slide. So on the left in the red box, we have our minimum coverage that we need to have when we become eligible for Medicare. So original Medicare refers to Medicare that you get through the government. So well, we'll explain that when we get to Advantage plans a little bit more. So original Medicare is managed by Centers for Medicare and Medicaid Services, and that is your Part A. That's your inpatient insurance. So hospital inpatient, hospice, and nursing home for rehab. Part B is our outpatient. So doctors, outpatient labs, outpatient tests, outpatient in the hospital. Because over the last several years, when we're in the hospital, we're not always listed as inpatient. Doctors have very specific criteria that they have to follow to make you inpatient. And it's much more common for you to be listed outpatient or observation status. So that's important to know too when you're in the hospital, because that's going to affect what your deductibles and copays are. Because if A pays, your amounts are going to be different if B pays. Now, if you are on Medicare and they keep you observation status or outpatient, the social worker is required to bring you a document for you that explains all of that and for you to sign, just so you know. And then Part D, which is our drug insurance. So when you become eligible for Medicare, these are the 3 parts that you need to get unless you have employer insurance, either insurance of your own through your employer or your spouse's employer. And then if the employer has 20 or more employees and you're getting Medicare due to being 65 or older, then you can delay your Medicare enrollment. If you like your employer insurance, it's working well for you, the costs are low, then you can keep that as long as you have that creditable employer insurance, 20 or more employees. But if you're getting Medicare due to age, that magic number for the employer has to be 100 or more employees. So that's the only loophole, is having that employer creditable insurance. If you don't have that creditable employer insurance, you need to take Medicare when you become eligible, or you will get a penalty, which means you're going to have to pay a higher premium, and we don't want that. Now, we have 2 options. So once we have our A, B, and D, we get to decide how we're going to keep our medical costs as low as possible. So the middle option, option 1, is again still having that government-controlled insurance, A, B, and D, and then getting a supplement, also called a Medigap. So that is something that you're going to pay an extra premium for. Usually it's around $100 to $150 a month, and there's different plans. So for right now, we're just going to focus on the one that has the most coverage right now. That's a plan G. So that supplement is going to cover your Part A deductible, your Part A copays, your Part B copays, hospice copays, and nursing home rehab copays. The only thing it doesn't cover is your Part B deductible, which is $240 this year. So if this is the option that you pick, you're going to have Part A through the government. Usually there's no premium for that. Part B, this year, the premium is $174 a month. You're going to pay your Plan G premium for the supplement, anywhere from 100, 150. You're going to have your Part D coverage, and there's different plans for that out there. So those premiums range from anywhere from a $0 premium all the way up to like a $100 premium. And the medicine you take is really what's going to determine which plan is the best and cheapest for that. And then you just have your Part B deductible that isn't covered by the Plan G supplement, which is $240. That's all you're going to pay. You go to the hospital, you'll have no copay. You go into the nursing home for rehab, no copay. You have to take an ambulance trip down to Indy, no copay. So, little bit of story before we move on to option 2. So going back to that first slide or first box in red, the minimum coverage. When you just have A, B, and D, and you have no secondary insurance, you are at risk of paying crazy amount of copays and deductibles for the year. So picking on Part B, if you don't have an Advantage plan, a supplement, Medicaid, any other kind of secondary insurance, you will always pay a 20% copay for Part B. There is no max out-of-pocket protection with Part B. That means you will continue to pay 20% and 20% and 20% and 20% over and over and over again. So we had a client up here in Lake County, I think he was from East Chicago, and he had a medical emergency. All he had was A and B, and he had to take an ambulance trip to a hospital down in Indianapolis. His 20% copay, not the cost of the ambulance trip, the copay that he owed was $15,000. I don't know about you all, but I could not afford that. I would just cry. So that tells you that it's very important to have one of these options. So option 1, we talked about what that would kind of look like and what your limited out-of-pocket costs would be. Option 2 is an Advantage plan. And I'm sure we've all seen the commercials for those on the TV, because all of those Medicare commercials are for Advantage plans. Now, this is a different way of doing your Medicare. It takes your Medicare away from the government. You still pay your Part B premium. Part A is bundled into this as well. You have Part D bundled into this as well. There's usually no premium for the Advantage plans. There's a couple out there with a small premium, like $19, $24. You do get extra benefits: vision, dental, hearing, silver sneakers, pest control, transportation to the doctor, over-the-counter drug stipend. So a whole wide range of things that Medicare itself does not cover. These are extra things that the specific insurance companies offer you to make you want to have their plan and join their Advantage plan. So there's pros and cons with Advantage plans. There are networks that you have to follow with Advantage plans. So you can't go anywhere in the United States on an Advantage plan. Usually it's only going to cover you in your specific area where you live. And if you go outside of that service area or you go out of state, that Advantage plan most likely will not cover you. And they have the right to deny services. So if the doctor says, you know, Megan needs an MRI, the insurance company can say, no, we don't think Megan needs an MRI, and deny services. So those are some of the risks, you know, having to watch those networks, not being able to go out of state, or the potential of denials on Advantage plans. So they're good for some people, they're not good for everyone. You do still pay your Part B premium. Again, usually no premium. If there is, it's very low. Now, here is the benefit, or one of the benefits to Advantage plans. If you're someone that doesn't have enough health issues to benefit from a supplement, or you can't afford a supplement, then option 2, an Advantage plan, is going to be good for you, because you're not going to be like the gentleman in Lake County who had to pay $15,000 for his ambulance trip, because Advantage plans have a max out-of-pocket protection. Each plan is different. They range anywhere from 2,900 all the way up to 11,000. So when you're looking at an Advantage plan, you want to try to find one on the lower end, 5,000 or less. So how that works is, let's say your plan max out of pocket is 4,000. You have a heavy medical year, you will pay $4,000 in deductibles and copays. When you hit that amount in that year, the plan will pay at 100%. And then it recycles every year. So it cuts down on what you are going to owe if you do have health issues. All right, let's touch a little bit more on Part A. Some people call Part A our hospital insurance. I like to call it our inpatient insurance because you have to be inpatient in your setting. So inpatient at the hospital, inpatient for rehab at the nursing home, getting blood inpatient. Now this one is kind of a little complicated. Certain inpatient, non-religious, non-medical health care and approved religious, non-medical institutions. No idea what those are. Never have understood it. I did look it up once. The closest we have to Lake County would be down in Indianapolis. I tell people, if you ever have to go to one of these places and you need help understanding it, give me a call and we'll figure it out. After 11 years, no one's ever called me. So I don't think it comes up frequently, but I will aim to help if anyone does have to go to one of those facilities. Home health care is covered under Part A as well, and hospice care, whether you get hospice at a hospice home, a family member's home, or your home, or the nursing home. All right, so let's talk about Part B. And again, just because of time, we're just doing a high-level review of Medicare. I'm hoping to wrap up in a few minutes so we can talk about questions, and then if anyone wants an appointment to talk about your situation more specifically, we can always set that up. So Part B, again, is our outpatient. Outpatient doctors, specialists, primary, surgical services, tests, labs, durable medical equipment, diabetic testing supplies, and preventative services are all covered under Part B. I want to touch on preventative services really quick. So those services include like a wellness visit every year, depression screenings, cancer screenings, heart screenings. We also have some of our vaccines that are covered under Part B at 100%, so no copay. So that's our pneumonia, RSV, flu shot, and boosters. So your COVID boosters are covered under Medicare at 100%, including the new one that just came out for the new strain. The other one that I want to touch on for preventative, because this can get a little confusing. So mammograms and colonoscopies. You have to be careful with those because sometimes they're not considered preventative, and you will get a copay if you have a colonoscopy and a mammogram. So we're going to pick on mammograms because that's usually the easier one to talk about. So when you turn 40, you can get a yearly mammogram. And no matter what insurance you have, there's no copay because of how it's written into the law right now. And that includes Medicare. So you go in for your yearly mammogram and you're not having any signs of anything. There's no lumps, there's no pain. And you just go in because it's your yearly time to have them looked at. There will be no copay for that. Now, let's say you go to your doctor and you tell your doctor, well, I'm feeling a lump. Your doctor feels a lump. They order a test, a mammogram. Because there's signs and symptoms, there will be a copay for that because now it's a diagnostic procedure. So just keep that in mind. It's the same with the colonoscopy. If you're just going in for your normal routine colonoscopy, no copay. But if you go to the doctor because you're having issues in that area that would require them to order a colonoscopy, you will have a copay. All right, so we're going to talk a little bit more about those Advantage plans and the supplements that I talked about just a few minutes ago. So a Medigap, also called a supplement, is with a private health insurance company. We have life insurance companies that sell them, Allstate, State Farm, Anthem, Humana, United. Now, all of these companies have to be approved by the Indiana Department of Insurance, and they supplement your original Medicare, your A and your B, through the government. So they do help pay for some health costs that original Medicare doesn't cover. So those co-pays and deductibles that come with Part A and Part B. And then Medicare will pay first and the supplement pays second. You can go anywhere in the United States with original Medicare and a supplement. It doesn't matter who you have that Medigap through. It'll still be covered if you go to Arizona for a vacation, as long as your A and or B has paid first, your supplement is required to pay out second. So this chart gives us all of the plans that are available right now. Now, everyone make note, either by writing it down or a mental note, that Plan C, here kind of in the middle, and Plan F is no longer available to those that became Medicare eligible after January 1st, 2020. So those, if you were eligible for Medicare before 2020, you can get a C or F. Or if you have a C or F already, you can keep it. But for those that their Medicare started after 2020, you cannot purchase a C or F. Those went bye-bye for new Medicare individuals. And those had the most coverage. A Plan F covers everything that the Plan G covers that I talked about, including that deductible for Part B that G does not cover. C and F were the only ones that covered that Part B deductible. All right, so now we're going to talk about those Advantage plans. So again, these are with private companies that are approved by Medicare. Medicare pays the private insurance company monthly for providing you with your Medicare benefits. Again, they cover the A, the B, the D, and those extra benefits. You will hear this called Part C, Medicare health plans. Doctors' offices like to call them Medicare replacement plans or Medicare choice plans. Again, another confusing piece with Medicare. You've got multiple names for everything. Well, what does this mean? So if you hear those are referring to the Advantage plans. And they're based on where you live. So when we look up plans for you, when we're helping you compare plans, buy or enroll in plans, we're going to put in your zip code. So if you move, you need to make sure that that plan still covers you in your new zip code, or you may have to purchase a new plan. And you only have a limited amount of time to do that. So if you move, it's important to follow up with your Part D plan or your Advantage plan to make sure you're still covered. And that when you move, it's 63 days that you have to make changes. All right, so this slide, and I believe, yep, the next slide are two of my favorite slides to go over. So this one, we're going to just do a review of what the Medigap covers and what the Advantage plan covers. And then the next slide, we're going to talk about the types of individuals that would fit in to each of these options to just kind of get you thinking about what might be a good option for you. So on the left, we have original Medicare with a Medigap supplement. So again, it covers your A and B benefits. Centers for Medicare and Medicaid Services provides A and B benefits directly. You have your choice of doctors and hospitals that are enrolled in Medicare and accepting new Medicare patients. A and B coinsurance paid by all the Medigap plans. Deductible coverage and additional coverages provided by some Medigap plans. And it generally costs more now in monthly premiums with few medical bills when your insurance is used. On the right, we have our Advantage plans. So it covers A and B benefits and may cover additional benefits. Coverage provided by private insurance companies approved by Medicare. In most plans, you need to use plan doctors, hospitals, or other providers, or you may pay all or more of the costs. You may pay a monthly premium, but like I said, usually if there is, it's like $20, $30, but you do still pay your Part B premium, and usually a co-payment or co-insurance for coverage services. So this one usually costs less in monthly premiums, but you are responsible for leftover medical bills. Now, let's talk about our usual candidates. So I like to say I'm the one on the left when I get onto Medicare, original Medicare with a Medigap. Someone coming into Medicare with pre-existing conditions and high medical costs, someone not running to take the risk of high medical costs due to future diagnosis. That's where you want to think about what's in your family history, mom, dad, siblings. Spend part of the year in a different part of the country and wants the ability to see any doctor that takes Medicare. Willing to pay higher monthly costs and in return could have lower out-of-pocket medical bills. Now we have the person on the right, the Advantage plans. I like to say this will be my husband. Someone who comes into Medicare healthy, it does not go to the doctor or hospital often, assumes they will continue to be healthy in the future. Maybe they financially cannot afford to pay higher monthly premiums associated with original Medicare and a supplement, and willing to stay in a smaller network of doctors and hospitals. All right, drug coverage. So we have two ways that you can get your Medicare drug coverage. That is with a standalone Part D plan or through your Advantage plan. They are all approved by Medicare. They're with private insurance companies, and anyone with Medicare can get drug coverage. Okay, so we're going to go back real quick. So starting January 1st, 2025, we have some amazing things happening with our Medicare drug coverage. Right now, there is something called the donut hole. I like to say it's the most stressful donut you'll ever deal with in your life. So if you're on brand name medicine, lots of medicine, once the retail cost of your medicine in the year reaches $5,030, you go into the donut hole. And that means you have to pay a higher copay. Just for reference sake, let's say you're on Ozempic. It's a diabetes, it's not insulin, but it's an injectable. And at the beginning of the year, you're going to pay your deductible of $545 for Ozempic. Once that's paid, you're probably going to pay about $47 a month for your Ozempic. If you go into the donut hole, that $47 jumps to $140 that you're going to pay a month for Ozempic. And that's a rough estimate depending on what type of plan you have. So the donut hole is going away. That's number one good thing. Right now, the true out-of-pocket costs that a person could pay in their copays for a year is close to $4,000. That is dropping down to $2,000. Another good thing. But we have some people that have to pick up lots of expensive medicine in the beginning of the year. They have to pay that deductible. They have high copays. So in the first month, 2 months, 3 months, they're already paying that $2,000 out of pocket. Now, once they hit that $2,000, they won't pay any copays for their medicine for the rest of the year. But I don't think there's many people that can afford paying $2,000 to the pharmacy in 1 month, 2 months, 3 months. Heck, even 12 months might be a hardship for some people. So every plan, Advantage plans or Part D plans that are out there for Medicare will now be mandated by law to offer payment plans, which means if you opt in for a payment plan, when you go to the pharmacy to pick up your medicine, you won't pay them anything. You won't owe them a dime. You'll get your medicine, you can leave. The insurance company will send you a bill every month and you pay them. And it's going to be a spread out payment plan. So if you are someone that reaches that $2,000 in a year, the most that you're going to pay in a month is $167. So you'll pay out for the whole year, but it will be more even and more manageable. So when you meet with a SHIP counselor, or if you work with an insurance agent, or you do it on your own for fall open enrollment, which we're going to talk about shortly, talk to them and ask them about the payment plan. That's something that SHIP counselors should be bringing up, educating people on, and educating you on how to get signed up for that. All right, so these are our costs for Medicare. Now, these are the costs for 2024. We do not have the numbers yet for 2025. So our Part A generally has no premium. The deductible when you go into the hospital is $1,862. And how it is set up is a little unique than the other parts. So you may owe that deductible more than once in a year. I had a counselor calculate it once, and if a person timed it just so, they could have to pay that deductible up to 6 different times in a year. So that's a lot of money. Your copays are going to vary depending on how many days you're in the hospital. The Part B premium right now is $174 and some change. Our deductible is $240, and then we have that 20% copay. Now, if you are on an Advantage plan or a supplement, the Part B copays go away, the Part A deductible goes away. If you're on an Advantage plan, the prices vary. So again, there's generally no premium. Generally, there's no deductible. Your copays are going to vary depending on what plan you pick. They can come up with their own equation. And then that max out of pocket is anywhere from $2,900 to $11,000. I think I needed another 0 on that. Our supplement, again, is roughly between 80 to 130, depending on what plan you're looking at and what your age is, a month for the premium. There's no deductibles and there's no copays on the Medigap. And then our drug coverage range is between 0 to 70, sometimes up to 100. There is a deductible for drug coverage, but only if you're on Tier 3 or Tier 4 medicine. If you're on Tier 1 or Tier 2, you're not subject to that deductible. That deductible will be $590 next year, and then the copays vary depending on the medicine you're on. All right, so we already talked about the medication piece to what is new to Medicare next year. The other piece that is new to Medicare is for those that are under 65, right now in Indiana, those individuals do not have good options to get a supplement. Starting next year, they will be able to get a supplement. So if you are under 65, if you were not able to get a supplement, you wanted a supplement, you know someone that wanted to get a supplement, come talk to me. We'll set up an appointment, because right now you can only get a Plan A. Plan A covers your Part A coinsurance, your Part B coinsurance, blood coinsurance, hospice coinsurance. That's it. And there's they can raise the cost for those premiums for those that are 65 or under 65. So generally, someone that is over 65 that gets a Plan A, you're going to pay $70 a month. Those that are under 65 are going to pay $250 to $700 a month. So that jacking of the price is going to go away next year. So if you, just because of time, if you fit that bill and you want to learn more about that, we can talk afterwards, or we can set up an appointment. And those that are on Zoom, you'll get my contact information and you can reach out to me. Okay, so what else should we know? And I promise I'm wrapping up so we can do some questions. So you may not need to take Medicare if you're still working. There are assistance programs to assist with Medicare costs. So if you, as a single person, your monthly income is under $2,300, your resources are under $9,000, you may qualify for a partial Medicaid that helps to pay for Medicare costs. You need to be in an enrollment phase to make changes to your plan. So you can't just wake up every morning and say, you know what, I think I want to change my plan today. You have to qualify for a reason to change. You are not stuck with the plan you pick for the rest of your life. You generally, You do not enroll when first, if you do not enroll when you're first eligible, you could have a lifetime penalty. So fall open enrollment. So this is coming up very quickly, October 15th to December 7th. Anyone with an Advantage plan or a Part D plan can come and see a SHIP counselor or an insurance agent to review your plan, to make sure you're on track. You're still going to be on the same plan if you don't make any changes for next year, or maybe you do need to make a change. Maybe your medicine has changed. Maybe your doctors have changed. Maybe the plan that you're on sent you information and they're upping their max out of pocket, or they're upping their premiums or copays or deductibles, and you want to see if there's a better plan out there. We advise that everyone on an Advantage plan or a drug plan review your plans at least once a year, because last year with drug coverage specifically, there were several people calling me saying, well, my plan was $30 a month this year. Next year, it's going up to $90. That's a big jump. And probably 99.8% of the time, we were able to find them a cheaper plan to move to. All right, so I'm going to leave my contact information up here, but now I think we're ready to do some questions. So the question is, can you switch between option 1 and option 2? So let me go back on my slides here. If you move, the second part of that, does that include family plans? No. Medicare is not a family plan insurance. You have to qualify for Medicare on your own, and then you can pick what works best for you, but there are no family plan options with Medicare. So what happens if you move? So if you are on option 2, which is our Advantage plans, you actually, if you move out of your service area for that Advantage plan, you do get an allowance to move to option 1 if you want to. Now, if you move and you're on option 1, you would be able to switch to option 2 because you'd be able to change your drug plan if that drug plan didn't cover you in your new zip code. And if you wanted to get your drug coverage through an Advantage plan that way, you could. Good question. So we have a question if it covers specific medication. And I have never heard specifically the medication that was chatted in. So this is how I'm going to answer it. One, that might be something you need to reach out to me individually, either through email or phone. And I'll go put that last slide back up to dig into that more specifically for your case. But this is how it works for medicine. If you have prescription medication that you take at home, or inhalers or shots that you give yourself at home, as long as it's a covered medicine through Medicare, it's covered under your Part D. If you have medication that you get through an injection that your doctor gives you at the doctor's office, or you have infusible medicine, that's covered under Part B. Most medicine is covered by Medicare unless it's something that's not covered by the FDA. So the question/comment is, she went to the dentist, she was referred to an oral surgeon, they did some extractions, she had to pay $1,000 up front, then they were going to bill her insurance and she would get reimbursed if they approved. And she ended up paying almost $3,000 by the time everything was done, and it was denied because the insurance company was not in network with the oral surgeon. And she wants to know if she has any leeway to appeal or get some of that money back. So dental coverage and Advantage plans can be tricky because, again, you have to be mindful that all the providers you go to are in network with your insurance before you go. A lot of eye doctors, audiologists, and dentists do not like Advantage plans because of billing complications. And most dentists, eye doctors, don't take Advantage plans. It also depends on what type of Advantage plan you have. If you have an HMO Advantage plan, which means you can only go in network, or if you have a PPO, that means you can go in network or out of network. If the dentist takes Advantage plans, that should mean that you should still have some coverage. So that might be something we need to talk about individually and maybe talk about doing some kind of appeal. Oh, so they did pay some. Okay. And there are very limited amounts that the coverage that you have with your Advantage plan for dental work is going to cover. It depends on what service you're getting. So you would want to look in your book to see what the max is they're going to pay for extractions or periodontics or any of the other services. 400 might be all that they pay. So the question is a follow-up to the dentist question is it better to ask the doctor's office, the dentist, whoever you're going, if they're in network before coming to a source like SHIP for assistance? Yes. Before you have any procedure done, before you go to see a new doctor, you always want to call them and find out if they're in network. And the doctor's office or the dentist would be able to tell you that. Well, let's say you got a new doctor, doesn't matter what kind of doctor it is, and you call and say, hey, I have a referral to see you guys. I need to schedule an appointment, but before I do that, I want to confirm my insurance is United Healthcare PPO Plan 1, whatever it's called. Do you guys take that? And they should be able to tell you that. But yes, when you have an Advantage plan, you need to be very specific. If you're just on original Medicare, you can call them and say, hey, do you guys take Medicare? Because that's the insurance. But if you're on an Advantage plan, it's not good enough to say, do you take Medicare? Do you take Anthem, Humana, whatever it's called? Yes. So what I'm hearing as the question is, a Humana Advantage plan denied in April? Okay, and how often can that happen? Is that the question? Okay, so I need a little bit more information. What was denied? Was it a specific service? If it was a specific service, Advantage plans can deny anytime they want. There are 12% denials on Advantage plans compared to original Medicare. So, and some plans are better at approving than others. Oh, okay. So what happened in Lake County and Porter County at the beginning of this year is Community Hospital, which is now called Powers Health. There's 3 hospitals in their system. They dropped contracts with Aetna and Humana, which can happen. It's very common practice with Advantage plans. So what you need to do is you need to look at getting another Advantage plan that is accepted by that hospital system, or changing doctors. Everyone has different preferences. You know, I don't know your situation. So those are kind of your options. Now, unfortunately, you most likely won't qualify for a situation right now to be able to change your plan to an insurance provider that is accepted at Powers Health. So you may have to wait till fall open enrollment. But if you did want to reach out to me, we could see if you qualified for those partial Medicaids that I'm kind of talking about. They're called the Medicare Savings Programs, because if you qualify for those, you get approved for those, then you'll get a special enrollment to change your plans. So unfortunately, that was a pretty big mess for people in Lake County and Porter County. Did you get affected by that too? That when she became eligible for Medicare several years ago, 2013, she
Yes.
had the Plan F supplement, which covers everything. She used the word Cadillac insurance, and basically that's what it is. That's the gold standard. Now, when the rules changed and they were not opening Plan F up to new individuals, she dropped it. That's fine. But now she's, based on what I'm talking about, she's wondering if she can go back to it. You can go back to it if you want. Now, if you do have health issues at this point, there's the potential that they're going to deny you, or your premium is going to be higher. due to age. So there's going to be some factors that you may not like at this point, but you can call insurance companies to see how much it would cost you to get a Plan F. And if that's something you want to chat with me more about, you can jot down my number and we can talk at a later date on that. But yes, you could try to get another Plan F if you wanted to. A follow-up from one of the online chat questions about the therapy medication, if it was covered. So what she's explaining is it's basically like supplements. So apple cider or broccoli supplements. And supplements, even though they're prescribed by the doctor, are not covered. So her follow-up question is, like, on Advantage plans, you get that benefit of like $40 a quarter or $200 a quarter, depending if you have Medicaid with your Medicare and what plan you're on, for over-the-counter drug benefits. It's going to depend on different factors: the plan that you're on and what their restrictions are, and where you can go purchase those items. Because sometimes you can go to Walgreens or CVS, but they have limitations within the store. So you'd have to talk to your insurance company specifically to find out what the restrictions of those drugs are. That is a good question. So if I get traditional Medicare, which is original Medicare, how do I get vision, dental, and hearing? Because vision, dental, and hearing is generally not covered by A and B or supplement. So this is what people do if they don't get an Advantage plan. You can just look online for private vision, dental, and hearing insurance. It's not Medicare. They're standalone packages. You look for what's going to have the coverage that you want, maybe covers the dentists and eye doctors you want to go to, and then you just sign up for that. The other option is, when you do get a supplement, when you call that company, you can ask them if they have vision, dental, and hearing packages. It won't be part of that supplement. It's going to be an add-on insurance rider. You're going to pay an extra premium for it. It's still not Medicare coverage, but that's another way to get that covered. So I had a question here, is if you want to use the SHIP services, what number do you use? So if you want to pick my brain or meet with me specifically, you would use the 574-323-7180 number or my email. If you can't get a hold of me, you really don't have a preference who you go with besides just being with a SHIP counselor, or let's say you have a friend or family member in a different part of the state, you can use the 1-800-452-4800. Now, what they're going to do is they're going to get you connected with a local agency. And I could even do that too. Maybe I don't have the availability to work with you or come out to where you are, but I can get you connected with one of my local sites. So either number is going to work. It just depends on your preference. Good question.
Megan, I would just like to thank you so much for taking the time to come all the way out to IU Northwest this morning, meet with our folks in person, also allow the opportunity for folks to join this session via Zoom, and go through this presentation, answer all those questions. It has been a wealth of knowledge. I know I learned quite a bit. I hope that everyone else did as well. And once again, thank you so much for being here with us.
Oh, you're welcome. Thank you. And I'm sorry I went over on time.
Do not apologize. You had great information to share. I appreciate that you were willing to go over.
Yes.